Have you been experiencing pain or swelling in your legs? Maybe noticed skin changes or wounds that won't heal? It can be frustrating when you don't get the right diagnosis, but that's why you have to find someone who can take a deeply personal approach to your needs.
That is exactly how Dr. Deepak Sudhindra operates at 360 Vascular Institute in Dublin. He's the founder and CEO, and internationally recognized expert in vascular health. Dr. Sudhi, so nice to meet you.
Likewise, thank you for having me.
Yes, now patients travel all across the country, even across the world, to come here to 360 Vascular Institute to receive care, again, right here in Dublin. Can you tell me just what is it that you all offer?
Well, Gabrielle, we offer a variety of care for patients with vascular disease. We treat patients who have peripheral arterial disease, which is a condition in which people have poor blood flow to the legs. And then we also treat venous insufficiency, which is a condition in which there is poor drainage from the legs. So those two things combined, we refer to as VAM disease.
And that's a term that you actually coined, right? Why is that? Is that because you're seeing a lot of patients with some of those issues?
Yes, VAM disease stands for Venous and Arterial Mixed disease, and it is a condition that affects millions of patients worldwide. And often, patients and healthcare providers don't recognize that a patient can have both conditions at the same time.
So what are some of the warning signs that people maybe should look out for VAM disease?
For VAM disease, if a patient has symptoms of pain with walking, if they have skin discoloration, heaviness and fatigue of the legs, non-healing ulcers or wounds in their legs, those are the symptoms that they should be looking for. If they have a history of diabetes, smoking, heart disease, being overweight, then they absolutely should be looking at VAM disease because it is extremely common in that patient population.
And you have patients traveling near and far just to come see you. What do you think sets you all apart from any other practice?
I think from when patients come here, from the moment they walk in, they will notice the difference. For example, we have free parking, so patients really just park, a few feet outside the door and walk in. So there is no big parking garage or big buildings, to walk through. We are not part of any of the large healthcare corporate entities, which means that we are able to focus primarily on the patient experience.
Okay, let's talk about some of the imaging, the equipment that you have, because that also adds to just the uniqueness of what you offer.
Yes, well, right now we are in what is called the angio suite or angiography suite, and this is where many of our procedures are done. Our procedures are minimally invasive, image guided, which means that we don't have any incisions. Everything is just a little puncture like an IV in the skin. There is no hospital stay. What's also very nice about a place like 360 Vascular Institute is that we are able to do the consultation, advanced vascular ultrasound imaging, and the treatment all under one roof.
That makes it so much better.
It does, because you're not going all over town for one place for your office visit, another place for your imaging. Everything is done right here.
And education is really such a huge part of what you do, right?
It is. Our website, which is 360vascular.com, has a wealth of vascular educational resources for patients for both arterial disease and venous disease, as well as some of the other things that we treat, such as uterine fibroids in women, chronic pelvic pain, and knee pain.
Yes. Okay, so if someone maybe wants to come in for a consultation, maybe they want to learn more about vascular disease and just awareness in general, where should they go?
Well, the first is go to our website, which is 360vascular.com, and then, making an appointment with our office. One thing that we want patients to look at us is really as an educational resource, not just as a place to come here for a procedure. We have a lot of patients that we don't operate on, that we really do just conservative therapy, and we educate them so that we can prevent them from getting into the later stages of vascular disease. So you really have to tackle vascular disease at its very early stages so that you can prevent patients from getting to the late stages.
Yeah, so you're with patients through whatever phase they are in, you all are right there.
That is right. We say once you become a vascular patient, you are a vascular patient for life. So when patients come here and meet me, we are starting a very long-term relationship.
Awesome. Such helpful advice, Dr. Sudi.
Thank you.
Thank you so much. Nice to meet you.
Yeah, likewise. Thank you for having me.
And you can request that appointment by calling the number you see there on your screen. That's 614-602-4088. And then you can also book online at 360vascular.com. And we were having a conversation after the interview, and he was just explaining all the different stories of how long his patients stay in appointments with him. Sometimes appointments with doctors will take 15 minutes, but he is very thorough.
Yeah.
Really wants to make sure that you have real solutions to your problems. So very important characteristics in a doctor.
Especially, I know a lot of those issues can cause people to feel a lot of pain and a lot of discomfort for a long time. So of course they want to feel heard and understood. So that's incredible that he gives them that attention. All right, awesome. Thank you, Gabrielle.